Hi, warm greetings everyone. Forge your weapons in the fire of need. How? Let's figure out with this presentation on dose-escalated intravitreal topotecan in retinoblastoma. Vitreous seeds have been identified as the most common cause of treatment failure post-chemotherapy, and intravitreal injection of chemotherapeutic agents solved this problem to quite an extent. It started with melphalan given in dose of 8 microgram, but high rate of recurrence was noted. So a shift was made to 50 microgram, but soon discontinued because of its propensity to cause retinal toxicity. So now a new balance was found between 20 to 30 microgram. Melphalan was then challenged by Topotecan because of its effectivity, safety and stability for longer duration. But refractory vitreous seeds were still a challenge. So a practice of combined Topotecan plus melphalan was initiated. Also, the effectivity of intravitreal topotecan at the dose of 30 microgram was emphasized. However, the suggestion of new high dose 90 microgram opened an entire new window of hope, specifically with its use for subretinal seeds and recurrent retinal tumors. So this study was designed with an aim of evaluating the role of dose-escalated intravitreal topotecan. It was a retrospective, consecutive, non-comparative observational case series which included 31 eyes of 31 cases over a period of 55 months. However, cases receiving any form of intravitreal, intravenous or intra-arterial chemotherapy were excluded. All the cases with focal seeds only in one quadrant received dose of 30 microgram, seeds in two quadrants received 45 microgram, seeds in three quadrants received 60 microgram, and highest dose of 90 microgram was given to those with diffuse or seeds in all four quadrants. For focal subretinal seeds, dose of 60 microgram was given and escalation was done to 90 microgram for diffuse subretinal seeds. Case with less than 3 mm size small subretinal tumor was given intravitreal topotecan in dose of 90 microgram. Following are the derived results of demographic details. Majority of cases belong to baseline group D and E, most common indication being diffuse vitreous seeds. Out of total 27 cases with vitreous seeds, primary dose escalation was done in 44% and 56% required secondary dose escalation. Interestingly, we found that with the secondary dose escalation, average number of injections required reduced to half. This case with diffuse vitreous seeds received 90 microgram IVT and laser TTT for the residual tumor showed complete regression. This case with dense cloud of vitreous seed completely cleared after 5 injections. Case with juxtapapillary seeds regressed and became amorphous. In this very interesting case of diffuse vitreous seeds, patient initially responded well to 30 microgram but soon became refractory but regressed completely after dose escalation to 90. Of total 9 cases with subretinal seeds, all responded well with an average of just 1 injection of IVT. Yes, you heard that right, with just 1 injection of IVT. In this case, with small tumor recurrence, which was refractory to TTT, regressed completely with just 1 IVT. Trial of IVT was also given to cases with endophytic budding type of recurrences, cases with multifocal recurrences, cases with juxtapapillary tumor recurrence, or optic nerve head tumor where the TTT is unfavorable showed satisfactory outcomes with complete regression in all. This is the regression pattern observed, and 62% regressed with a flat scar with an average of just 1 injection. In a mean follow-up of 6 months, we noticed cataract in 2 cases and injection site cystoid cicatrix in 9 cases. Till the end of our study, 21 cases remained regressed, but 10 cases showed recurrence with an evidence of main tumor recurrence in 6 cases. Rate of recurrence derived for vitreous seed was the highest, 33%, and lowest for the subretinal seed, 0%. In reviewing the literature, there were only 2 similar studies published till date, but our study was the largest in terms of sample size. And results were also quite comparable with the other studies, with initial tumor control which was seen in 100%, that is all the cases, and highest recurrence for vitreous seed, that was 33%. Despite best of our efforts, eyes which were initially unsalvageable because of resistant or refractory seeds or tumor are now amenable to eye salvage by just adopting this tailored approach of dose escalation. Just as the Golden Temple underwent restoration to regain its full glory, intravitreal therapy too at times requires revamp in form of dose escalation to achieve its optimal therapeutic outcome. Thank you so much.
Thank you, Ruju. My question is, what is the time interval between two doses of Topotecan?
Yes, sir. It was 4 weeks.
4 weeks. Thank you.